Hi, thank you so much for letting me speak. Is Julia still in the room?
She's running down the
I just wanted her to, so you can say hi to Julia. I'll grab her here in a minute. I just wanted to kind of let you know what brought me up to where I am today and kind of give you a little backstory here. A few years ago, I probably would have been sitting out in the audience with, a negative view of medical cannabis, but I'm here today to tell you that it's going to save my daughter's life. So I have dual role here. So I'm a pediatric nurse practitioner at Strong and Highland in Rochester, New York, but I'm also the mom to two great girls, and I think one is probably in the pool, and the other one is running the halls. And then my poor husband out there, I think, drew a very short straw when he married me. But so I've spent the last 18 years caring for children and their families. I've taken care of the sickest kids in upstate New York. I've transported children who are clinging to the life in the back of an ambulance. I've traveled to South America and operated on children who had severe facial deformities. I've even held the heart of a newborn baby in my hands to provide compressions in efforts to save his life. Some of this I was not comfortable with, but I did it because it was the right thing to do, and parents were depending on me to take care of their child. 3 short years ago, I found myself on the other side of the bed. Our daughter, Julia Grace, at only 4 years old, was diagnosed with epilepsy. We were optimistic that the first drug they prescribed would effectively treat her seizures, and life would resume as normal. This was not the case. We tried 12 medications, all with no relief from her violent seizures. Some of these drugs made her seizures more frequent and more violent, ripping her to the ground as she angelically played with her sister Delaney in the backyard on their swing set. We pressed on with other treatments, IVIG, the ketogenic diet, and more medications, all which had little or no effect and left us with a little girl we hardly recognized. The seizures ensued, and so did the horrific side effects: bone loss, muscle atrophy, liver damage, hair loss, cognitive delays, behavioral issues, and near fatal reaction, which took several months to recover from. I resigned from my job as Julia's care became all-consuming and her ability to do daily tasks diminished. We canceled vacations, altered her school schedule, we installed a video monitor in her bedroom, and eventually had her sleep in our bed so we can watch her 24/7. We lived an isolated life in efforts to keep Julia safe and protect her from the daily violent seizures. We constantly divided in efforts to allow Delaney some normalcy. The dreams we once had for our family disappeared. We continued to educate ourselves on treatments that were available and lean on our physician to help guide us on what to do next for Julia. Their suggestions were more drugs, highly addictive, psychoactive narcotics, which she would eventually become dependent upon and need more to help treat her seizures. I remember lying in bed next to Julia one night when her seizures just wouldn't stop, and I prayed, "Dear God, please take her if this is going to be her life." No mother should ever have to say that prayer. As we watched Julia slip further and further away, we began investigating an alternative treatment that was being used in other states with good success rates. Actually, the success rate was far beyond what any of the medications being offered to us would produce. Medical cannabis in the form of an oil taken orally was offered to children in Colorado for a chance at a better life. As we looked further into this, we realized the treatment option was not available to Julia in New York State. They consider it illegal. We were once again faced with a life-altering decision: continue to allow Julia to suffer from her daily grand mal seizures or move to Colorado. This move would split our family. Julia and I would have to live in Colorado while Tim and Delaney stayed in Rochester. This is a decision no family should be forced to do. A year and a half ago, I would have never imagined that this would be a treatment option I would be thinking about for our daughter. Yes, she's 7, and I'm asking for medical cannabis to treat her seizures. However, as life continues to morph and change, so does the world around us. As we look to the future and health of our daughter, we will exhaust options to the end. We have learned that we are not alone, and there are many other New Yorkers who are suffering chronic and terminal illnesses that are walking our same journey. They have sat next to the hospital bed of loved ones, watching prescription drugs destroy them and wash away their quality of life. The political stigma associated with a plant that denies the medical benefits for those suffering is a most unfortunate reality for us. We were once uneducated on the subject of medical cannabis, but we are now educated. I encourage you to sit with an open mind and listen to everybody speak today. Science is proving the stigma wrong. Researchers are stepping out to support the benefits of medical cannabis and urging patients receive treatment today, regardless of their zip code, no longer waiting for research to be done. One day, someone close to you may dearly be affected by this matter. Thank you.